Alright, I want to explain about how anxiety and how it impacts the body from a scientific perspective, so you guys can kind of understand what's going on. People that have anxiety disorder or maybe panic attacks, you know somebody, maybe this will help give you clarity, and know that you're really not alone. And I'll get to that later on in the video. But first I want you to understand with anxiety is that you want to make sure first that it is anxiety disorder, that it's not a thyroid, so you can go get your thyroid checked with a blood panel. And you can also, maybe if you're in the ER or the doctor's office, get an EKG if you're having anxiety. These are good ways, good diagnostic tools through to make sure it's not something physical. But now if you have anxiety, let's kind of get into the scientific aspects of it and how it impacts your body. And basically I want to go over a couple things: adrenaline, dizziness, digestion, and basically your metabolic heart rate. Okay, so first off, let's go over adrenaline. Okay, adrenaline, clinically, the definition of adrenaline is the hormone that speeds up your heart rate. People with panic attack, anxiety disorder know this all too well, right? The fast breathing, your heart racing, you feel like you're having a heart attack. You know it all too well. And trust me, I've experienced anxiety myself, so I sympathize with that. But let's get into the science behind it. Basically, we're trained to have adrenaline, right? So we just went over this. It's the hormone that speeds up the heart rate. And that's basically what's happening to you. Now, we are naturally designed by nature to have this. It's normal. Like if a dog was chasing your ass, right? We're designed to have that adrenaline to speed everything up and run quick. Kind of make us superhuman or super physiological during that time. But you're having this problem and a dog's not chasing your ass. You're sitting down and watching a movie, or you're doing something, and you just start having these adrenaline spikes, or your rapid heart rate is going on. And so there's a disconnect between the stimulus that's happening and your reaction to a stimulus. This all makes sense. So basically that's what's happening, is your adrenaline's kicking in, it's speeding up the heart rate, and basically is making you breathe faster, and everything else is going faster. So it's nobody going crazy here. It's simply just pure science and how your body just handles stimuluses and responds to them. Okay, so that's really what's going on with the whole adrenaline factor. It's kind of like a dog's chasing your ass, but realistically they're not, and you're sitting there having a panic attack. So I hope I covered that part, because that's what's really happening. So it's a hormone that speeds up the heart rate, adrenaline. Okay, so you have that going on and you're sitting there and you're breathing. Now let's go into the dizziness component. A lot of people will complain that they're, besides having like fast heart palpitations or something like that, due to their adrenaline and their stimulus and their response, also a lot of people complain about dizziness, and I for one have had this. Dizziness is basically what's happening is because everything's getting sped up. And I kind of want to explain this in a little bit of detail, but because everything's speeding up. So what happens is that you're depriving your body a little bit of oxygen, okay? And when you do that, you kind of get dizzy. When you breathe really quick, you have people go, they breathe really fast. And so when you breathe really fast, basically you're creating less oxygen to the brain, okay? No, you're not. If you realistically you have anxiety disorder, you rolled out all physical components, you're not going to die from this. It's just purely you getting dizzy from you breathing very, very fast, okay? And basically it's depriving some of the oxygen going to the brain. It's going to be temporary, and, that's what's really happening with you, okay? You're not having a heart attack, you're just getting dizzy because of the lack of oxygen. Everything's getting sped up, so when you breathe faster, oxygen's coming in, out, in, out, in, out, in, out, and basically, your blood's coming in, out of your heart, so everything's just getting sped up extraordinarily fast. So I hope I covered that for you. That's the dizziness component of that, and so that's why a lot of people get dizziness, is the quick breathing. And that's why you see a lot of people that breathe in the paper bags. The oxygen can kind of come back in easier. So I hope that explains that part of that. Next thing I want to go into is digestion. A lot of people, normally, this is a normal stimulus, is that you go out on a date, right? And you kind of get butterflies in your stomach the first time you go out on a date. You kind of get those like nice little butterflies and all that type of stuff. But what if you get these weird butterflies and you're not going on a date? You know, you're sitting down at work casually, or you're just driving on the freeway. You're just doing those types of things. Maybe you're in the weight room, and you know you're getting these cramps. And anxiety can affect a lot of things, and I'm going to tell you the science behind it. Actually, serotonin. Most people think it's in the brain. Anybody that takes anti-anxiety medication, antidepressants, I don't care if you have OCD or if there's bipolar people, anxiety, serotonin is a big word. Okay, you have serotonin, it's just thrown around, but actually serotonin, most of it, 75 to 80% of serotonin is actually in your GI tract. It's not in your brain. You only have about 20 to 25% of serotonin that's in your brain. So it's no wonder why that people with anxiety disorder have stomach cramps, can have stomach cramps if it affects you that way, can have stomach cramps or diarrhea. And simply because basically you have, it can affect your GI. One is serotonin, but I want to get to another thing too. It's called peristalsis. Okay, peristalsis. And basically it's a series of muscular contractions that kind of occur in your GI tract. Peristalsis is just basically muscle contractions that kind of occur in your GI tract. Well, this peristalsis, or we'll just say GI contractions, when you have anxiety, I told you about adrenaline. Everything speeds up. Well, so does this process, these muscle contractions. And basically these muscle contractions can speed up 3 to 5 times faster than the normal amount. Right? So what I'm trying to tell you is that when you have anxiety, these contractions that move, these like waves, if you want to call them, we'll just call them waves, that move stuff through your body. Your digestive system is like a 30-foot long tube, okay? And you know, it does a lot of processing. It's responsible for a lot. When it gets affected by anxiety, and people have those stomach cramps, or maybe you have not just stomach cramps, but maybe it's more along the lines that you have, just diarrhea or other situations. It's no wonder why people with anxiety or taking the medications, that's one of the side effects that they can have, is because basically that process is getting sped up by 3 to 5 times the amount sometimes. So basically that if you ate something, it would go through you quicker. You can have diarrhea, or you can have just cramps. It may not go through you quicker. You might absorb everything well, but you have those cramps. You can have cramps through having anxiety, or that butterfly effect, those butterfly feelings. Realistically, that is due to that whole process. So everything's getting sped up quicker, and that's what basically it's called is peristalsis. That's basically what it is.